I've been asked to get started, so we can do our best to stay on time. I'm Amy Comstock Rick, the CEO. Get back to slightly more on time. I'm Amy Comstock Rick, the CEO of the Parkinson's Action Network, and I want to thank IOM for and ISSCR for hosting this workshop that I think has been fantastic. The Parkinson's community, as actually in the Parkinson's Action Network, has been over the years heavily involved in the issue of stem cell research policy. We were actively involved in the issue of federal funding, particularly for human embryonic stem cell research, and following the case all the way up to cert being denied on the Supreme Court. But actually that is a little bit ironic, because at the moment, in terms of therapeutic potential at least, stem cell is not offering a whole lot of promise for Parkinson's disease, at least in therapeutic. There's a little bit in human embryonic, but not a lot. For those of you who don't know a lot about Parkinson's, just to put it in context, it's a motor disorder with very significant non-motor aspects as well. We have nothing to slow the progress of the disease, and certainly no cure. And so some of the aspects of what one can only imagine, I cannot, feels like to be a patient looking at what your future is with Parkinson's disease. It can be pretty gloomy. And the word, it's not my favorite word, but the word we've been using here of desperation is in fact quite real. As I said, there isn't very much promise from therapeutic. There is for research purposes in stem cells at the moment. And actually nothing that I've almost ever heard of, even anecdotally, in terms of the value of autologous adult stem cell treatments for Parkinson's disease. So at one level, I have to tell you, it makes my blood boil when almost every list that Alta put up this morning has Parkinson's disease on it. I don't know who they're talking to and where it's coming from, but there is virtually no evidence that I have ever heard of. And I have enough respect for the Parkinson's disease patient community that if there were some reality to it at all, people would be seeking these treatments. That said, the hope aspect that we've been talking about today is hugely important to all of us as humans, not just those of us who are patients, which we really all are. And the value of being able to take control of your own disease and your own life and try to do something about it is also hugely important to all of us. We try to encourage in the Parkinson's arena for people to use that in terms of exercise and diet, but in terms of taking control of your disease, that's hugely valuable. And in fact, for Parkinson's, the placebo effect is very, very real, more so than many other diseases. So there is something going on in the brain when you think you have done something to benefit yourself. So while I'm being totally honest, it makes my blood boil when I see Parkinson's disease on those lists that Alta showed this morning, because there's no evidence that I've ever heard of that that either adult or certainly not embryonic at this stage would be valuable for individual people with Parkinson's who I know and care deeply about. I wish Michael's experience for them, because Michael says he feels better. And people who I know and love, who are in great pain and are looking at a very, very sad future, would like to have that experience. So from a person, CEO of a Parkinson's disease organization, I'll tell you my views on this it's quite complicated. It's very, very complicated. So that said, we are now, in terms of our discussion today, going to move away from the question of using the regulatory and legal framework to directly control access to care and data, to the idea of using indirect systems to ensure the quality of information and data that is available to patients, clinicians, and researchers. We're first going to hear about advertising, the strengths and limitations of controlling advertising, especially given the global nature of this issue. And then we will hear about how professional societies can drive quality control and work along either in parallel with or independent of the regulatory framework. And we're first going to hear about advertising and the quality of information from David Vladeck from Georgetown University.